Now, as the nation gears up to commemorate Children's Day tomorrow, we would like to focus on the health of our children as we discuss the crucial topic, investing in the health of our children. Our children are our future, and their health and well-being are paramount to building a prosperous society.
There we go. Now, joining us today is Dr. Ayodele Renner. He is a consultant pediatrician. We also know him as the noisy pediatrician. The noisy pediatrician. Let's go. Anyway, to discuss the current state of Nigeria's health and children's health in Nigeria and what needs to be done to improve on it. So, welcome, Doctor.
Thank you, Judy.
Welcome,
Thank you, Mazino.
welcome, the noisy pediatrician.
Yay.
There we go. Yay. Welcome. Let's get started. Many thanks for coming on. Right, you are in the sector. You work every single day with children. You have to deal. I mean, before now we're talking about something that between three of us.
Yes.
Which has forced many of medical, of a brain draining sector. Yes. But talk to us about the current state of healthcare, particularly as it pertains to our children.
Okay, so happy Children's Day to you both, kids.
Sorry. Sorry. I always laugh that I'm a developing child. I need my breakfast, my lunch, and dinner.
Children are hard. So the state of the Nigerian child is something that leaves a lot to be desired. It's not all doom and gloom because at the very least we've eradicated polio from Nigeria, which of course is something that we need to celebrate. Yes. But when it comes to neonatal, which is children below the age of 1 month and under 5 mortality, specifically for under 5 mortality, no other country in the world has a higher under 5 mortality than we do in Nigeria. And when it comes to a parameter that we call stunting, which is if a child is not as tall for their age as they would expect, Nigeria is about second, in the world for that parameter.
So are you saying that the short men that we see around, it's not their fault?
I'm vertically challenged.
No. I did not want to go there, but Judith did, so.
So when you talk about people who are short for age, you mean specifically that they are below a certain, what we call a percentile, such that everyone falls within a certain margin, and if they fall beneath that margin, we call it the centile, the third centile, then they are considered to be short for age, and that has its problems, which of course I guess we're going to discuss.
Okay. Now, regarding investing in the health of our children, that starts from when we're babies. You've talked about child mortality, and God help us in Nigeria that we're able to overcome that one. But now, after a baby is born, and in the process of growing, let's say between the age of 0 to 10.
Yes.
I'm a parent, and I know how much I love to say yes to my daughter. Do I want this? Do you want this? Yes. Daddy, I want this. Yes. And am I doing any damage when I'm doing all of this prize-giving day? Have a candy, have this. How does that affect children's health, especially when it comes to the consumption of maybe genetically modified foods or perhaps maybe other consumables?
Yes. So when it comes to offering children, because nutrition is probably the most important aspect of child development, because without nutrition and adequate, food, then children fail to develop adequately. And food is really one of the ways in which parents show that they love their children.
You bet.
Yes, indeed. And sometimes they can go overboard with quantity and with quality. Now, when you give a child sweet treats as a reward for good behavior, it reinforces the idea that the treat is the reason for the good behavior and not necessarily the behavior in itself. So the behavior should be in itself the reason why they should behave well. So the sweet treats should probably be reserved for just specific days, birthdays, on a scheduled basis. Now, the risk of offering sweet treats is obesity, tooth decay, and then, of course, if it's persistent and there's a genetic predisposition to it, they can develop hypertension, diabetes, and other chronic medical conditions later in life. However, when it comes to, things like preservatives, GMOs, I know that we have a very diverse range of people in Nigeria. There are those who are, relatively well-to-do, middle class, upcoming. We tend to have access to a bit more of these things that are chock full of preservatives and, those modified things. And we want to limit those to as few times as possible during the week because you can't avoid them altogether. A child cannot go to a birthday party and be eating leaves and grass. They're going to offer them ice cream and really nice stuff. Let them have those at those points in time. But don't keep them in the house because once you have them lying around in the house, the fries, the chips, the crisps in the bags, then you know that you are forming a habit where they will turn to those things, as snacks when they're tired.
Now, like you said, nutrition plays a vital role in a developing child, and investing in it is very important. But we must, put it in a wider context. In fact, that Nigeria, there's still insecurity affects food as well. The price of food has skyrocketed in the last 12 months or even before that. And so when you look at the NBS and the stats that they put out for a healthy a meal, not every Nigerian family is able to provide that on a standard
or afford it,
or even afford it. So with that in context, what are some of the pressing challenges, health challenges that children in general in Nigeria face today?
I mean, Julius Mazino, you both know this, that the cost of living is a global crisis. And of course, it seems to hit harder in places where the economic and financial capacity to earn of parents is actually limited. And so we cannot, separate the child and the family in isolation. We have to empower parents to be able to take care of children. And so economic empowerment across board is absolutely essential when it comes to having to provide for children as far as nutrition is concerned. There's a UNICEF report that is coming out about the minimum dietary diversity. And what we mean by that is that every day a child must get at least 5 food groups, including fruits and vegetables, fats and oils. They must get protein and they must get rich organic carbohydrates. We find out that a lot of children in Nigeria, all they eat is carbohydrates. Barely any protein, barely any good fats or oils. It's all this, groundnut oil that is in the nylon
sachets, nylon bags. Sachets even better. Nylon bags. I'm sorry.
Nylon bags. I'm not even sure if it's extracted from crude oil, if it's actual plant. So so those things, and so you find out that this is leading to iron deficiency anemia, and this is a very common condition in which the child lacks iron. They are more susceptible to infections. If they have a supposedly mild infection, they can succumb to that infection very easily, and it affects their school performances such that they are not learning optimally because their brain simply has gone into survival mode where the brain is trying to just keep itself, alive, and you are now bombarding it with figures. 8 plus 8? No. The brain is trying to survive.
While we're on the subject of healthcare, let's talk about accessibility for kids here in Nigeria. I'm sure that you've perhaps maybe been to places where you've seen kids who have very common, ordinary perhaps, illnesses, but can't afford or access these healthcare. The situation in Nigeria is predicated by many factors, one of which is poverty. But how can we still, and yet, invest in our kids by paying attention to their health in areas that it might not be that accessible? What can parents do?
I think it's a great perspective you've brought because universal health insurance is absolutely non-negotiable. And capturing the formal and I think the non-formal sector, the informal sector really is, where the challenge lies. So we really need to begin to educate and enlighten parents about the idea that healthcare insurance is very important because emergencies can happen at absolutely any time. So, for instance, you've got the Lagos State Health Management Scheme, which is the LASHMA, where the parent can actually, pay as low as 400 naira a month to get access to care for themselves and their dependents, such that if the child needs to sort out any simple health issue, they can just go into any hospital that Lagos State government, LASHMA, the health scheme is recognized, and they'll get access care. Because what happens is that, and I see this on a daily basis, is that some parents come, they really want care for their child, but because they have other pressing needs, they don't have money out of pocket at that point in time to purchase some of the simplest and most basic drugs. So that is really key. And sometimes they don't even earn enough to actually have enough to save for school fees, save for food, and save for health. And so health always happens to be the one that they will pray away. That's why they must pray.
Go to church.
Yes, and pray,
Friday.
and pray that they don't fall ill. And while prayers are good, sometimes germs have other plans. Accidents have
I want you
other
to
plans.
highlight that again regarding the healthcare. Did you say for as little as 400 naira in Lagos State,
Yes.
families, parents can have access to healthcare for their kids? How do they
Yes.
access this exactly? Where do they go? Who do they pay this 400 naira to?
So there's the LASHMA scheme, which is Lagos State Health Management Agency. So if they go to Lagos State government website, they can actually get access to that. So LASHMA, and so they can pay. I know that it's a very affordable fee. I'll get the exact figure. Between 400 and 1,000, but they can pay that every month.
This is per month?
Yes, per month.
Okay.
Yes, per month, and they can pay that and have access to care for themselves and for their dependents. But of course, there are grades as usual when it comes to managed care. There are grades. Of course, the more you pay, the more likely you're able to get access to a lot more stuff.
You just talked about, insurance, when you think about it, is preventative, right?
Yes.
And same goes for, vaccination, that's also preventative measures. And there are other, like nutrition as well, eating healthy, they're all preventative measures from children falling ill
Yes.
in the more, dire situation in the future. But I want you to speak more on the importance of it. And also, has the culture against vaccination and immunization in Nigeria changed, or is it still the same where it's tabooed? And, you said earlier that we have now successfully eradicated polio.
Yes. So vaccines are probably the most groundbreaking invention of the 21st century, because smallpox, as we know, was eradicated because of the efforts of people that had made vaccines to eradicate those. Now, vaccine hesitancy, which is something that, and the anti-vaxxer movement is something that we know exists, and it exists for adults and it exists for children, because adults are the custodians of children and they make decisions for the children. Of course, as we know, during the pandemic, there was this whole movement of, you turn into 5G once you get that vaccine for the COVID, as in, you'll grow a tail, and I'm yet to get mine. Let me just highlight the idea that some people have been hesitant to receive vaccines, either because of side effects in the past, or the idea that some companies have acted unethically here in Nigeria. And so they are thinking along the lines of what their past experience has been. But vaccines are safe, they are effective, and they prevent thousands of deaths globally. What is being introduced now is the human papillomavirus vaccine, which is going to be given free to children, female children, from 9 to 14 years of age. It's being rolled out to prevent cervical cancer in them later in life. Now, just as an example of that, we found that in the initial rollouts, for other states, it seemed to have been really well received in the north central, but in Lagos, there seemed to have been some hesitancy to receive that vaccine because there was a lot of campaign, there was a lot of anti-vaccine campaign about that specific vaccine going around everywhere, on social media. But we have tried to let people know that this vaccine is safe, it's effective, and it prevents cervical cancer. So in the long run, the vaccination of getting your children vaccinated is probably the single most important factor in preventing infections and helping them to thrive later in life.
I'd like to take that one actually as my takeaway from today's conversation. Vaccinations are actually one way to invest in your children's health, especially for the future. So I'm hoping that other fathers like myself, and thinking about the tip on the human papillomavirus for female children from the age of 9. My daughter's turning 9 next month, in October.
Nice.
So I'll Thank you very much, Doctor.
Thank you.
Thank you so much,
Thank you, Judith, for having me on.
Thank you
Dr.
for
Renner
coming on.
is known as the Noisy Pediatrician on Instagram, and he has such beautiful content for everybody. And I'm hoping that you, parents especially, take today to actually go through his content and invest in the health of your children like he has just asked us to. Thank you once again, Doctor.
Thank you so much.